You know, we are right on the edge of a massive shift in how we think about artificial intelligence. For years, AI has been this incredible prediction machine. But what happens when it stops just predicting things and actually starts doing things? Well, that's the world of Agentic AI. And believe me, it's changing absolutely everything.
So, why is this such a huge deal? Well, the promise of autonomy is pretty simple, really. It's about creating systems that can take on these incredibly complex problems with a speed and an efficiency that, frankly, we humans just can't match.
Let's try to put this into perspective for a second. Just imagine an AI system that's constantly sifting through billions of data points all over the world, and it's able to spot the tiny, almost invisible signs of a new pandemic before anyone even has a clue it exists. But, and this is the key, it wouldn't just stop at predicting it. What if that same system could then instantly model how it's going to spread, alert all the right health departments, and even start figuring out where to send resources, all before a human expert has even had their first cup of coffee in the morning?
And here's the kicker. We're not talking about some sci-fi movie. This is real. This is what Agentic AI can do for public health, and early versions of these systems are actually being rolled out as we speak.
Now, to really wrap your head around this, you have to get the fundamental difference between the kind of AI we're all used to and this new agentic model. It's not just a small upgrade, it is a totally different beast.
Okay, I love this analogy. Think of most AI today as a really powerful calculator, right? You feed it some data, it crunches the numbers, and it spits out an answer, a prediction. That's where it stops. An agentic AI, on the other hand, is more like a whole team of analysts. It gets that number, figures out what it actually means, goes and finds more data, and then comes back with a recommended plan of action. So here's the more formal definition. At its core, an agentic system is running on a continuous loop. It perceives its environment, it sees what's happening, it plans what to do about it, it acts on that plan using all sorts of digital tools, and then, and this is the really cool part, it evaluates its own actions to learn and get better for the next time.
And this is that loop in action. It's constantly perceiving real-time data from all these different places. Then it plans out a series of steps to take. It acts on that plan, maybe by talking to a database, or an API, or a messaging system. And finally, it looks at the outcome, asks, did that work? And then starts the whole cycle over again. It's always learning, always iterating.
Okay, so this all sounds great in theory, right? But where is this stuff actually being used? Well, public health is one of the very first and highest stakes places it's being tested, where this kind of speed and autonomy could literally be the difference between life and death. So we're seeing these agentic systems being put to the test in three main areas right now: watching for diseases, managing resources, and coordinating emergency responses. Let's break each of those down.
So first up is disease surveillance. The old way of doing public health means you're waiting around for weekly or even monthly reports. These new agentic systems, they don't wait. They're actively monitoring dozens of live data streams, things like wastewater signals, pharmacy sales, ER visits, and they can flag a problem the very second it appears.
The second area is all about getting resources where they need to go, and the buy-in from the healthcare industry here is pretty incredible. A recent Deloitte survey found that a whopping 80% of health systems are now making agentic AI a priority for their operations.
So what does that actually mean? Well, in practice, it means using these systems to dynamically manage where critical things go. We're talking hospital beds, ventilators, vaccines, right in the middle of a crisis when every second counts.
And the third area is coordination. This is where it gets really interesting, because you can have multiple AI agents working together as a team. You might have one agent just watching the data, another one modeling different scenarios, and a third one drafting public announcements. A job that would take a team of people days to do can now get done in just a few hours.
This all sounds amazing, right? But this is where we have to take a very sharp, very necessary turn. You see, when a system only predicts things, humans are automatically part of the process. But the moment a system starts to act on its own, that whole dynamic changes. And that brings up a really big question. And this brings us to what might be the most important part of this whole conversation: the guardrails, the safety features. Because without them, a powerful system that was designed to help could, very easily, end up causing some serious harm. So we're really looking at three major risks. First, bias amplification. If the data you feed the AI is skewed, it can end up sending resources to the wrong places. Then you have accountability gaps. I mean, who's responsible when the AI gets it wrong?
And finally, there's something called autonomy creep. That's where a tool that was only supposed to give advice slowly, maybe even accidentally, becomes the one making the final decisions.
So the real question isn't if we should use this technology, but how we should govern it. And the key, really, is building in the brakes from the very beginning, using a really clear framework for how much autonomy these things should have.
Okay, level 1 is purely advisory. The AI can do all the heavy lifting, all the analysis, and it can present a recommendation. But a human being makes the final call. The human is 100% in control.
Level 2 is what we call semi-autonomous. You'll often hear this called human in the loop. Here, the AI is allowed to take action, but every single action it takes can be reviewed and even canceled by a human supervisor.
And then you have level 3, full autonomy. In this scenario, the system acts completely on its own, and the human is basically just notified after it's already done. This is obviously the highest level of trust, and it's also where you find the highest level of risk. And this right here is probably the most critical takeaway. Given how high the stakes are in public health, most of these systems need to be intentionally built to stay at level 1 or level 2. The goal isn't to replace people, it's to give them superpowers by keeping them firmly in the driver's seat.
You know, that quote really just nails it. Agentic AI is a tool, and like any powerful tool, whether it's good or bad, safe or dangerous, depends entirely on the rules and the oversight we build around it. The question isn't if we're going to use these incredible systems anymore, it's how well we're going to choose to manage them.